Hello, my name is Jonathan Herrick. I'm an athletic training student here at Oklahoma State CHS. I did my research over the effectiveness of early therapeutic exercise versus rest, ice compression, and elevation in treatment of acute lateral ankle sprains. My reviewers are Carly Alberti and Jennifer Volberding. A little background here. So lateral ankle sprains are one of the most common musculoskeletal injuries and go to the emergency department at a high rate. Uh, So it's about 7 to 10% of all admissions to the emergency department are lateral ankle sprains, and they occur at a rate of 2.15 per 1,000 persons a year in the United States. So lateral ankle sprains also account for nearly 16% of all sporting-related injuries. So a traditional treatment of lateral ankle sprains includes 4 to 6 weeks using ankle braces, along with rest, ice compression, and elevation during the first week to allow for healing. However, there are indications that implementing therapeutic exercise early during the inflammatory phase after injury, consisting of ankle range of motion and muscular strengthening, can return the physically active to normal activities of daily living sooner than using rest, ice compression, and elevation. My focus clinical question: does the inclusion of therapeutic exercise early in the rehabilitation process of a lateral ankle sprain return patients to normal activities of daily living earlier than the RICE therapy? My methods. So my patient population, I use physically active adults older than 16 years of age. My intervention was therapeutic exercise. My comparison is rest, ice compression, and elevation. And my outcomes uh, were to see a higher activity level after the first 2 weeks. Uh, I did this research back in October and November of 2020, and it was a computerized research. My inclusion criteria included must have used humans, uh, had to be written in the English language, had to be published within the last 10 years, level 2 evidence or higher, studies that looked at range of motion and muscular strength, studies that used grade 1 and 2 lateral ankle sprains, and studies that had a follow-up period after weeks 1, or that had a follow-up period of weeks 1, 2, and then also a long-term follow-up. My exclusion criteria were studies that used bracing, or that compared bracing to non-bracing, studies that used severe ankle injuries such as fractures and grade 3 lateral ankle sprains, studies that used medial and high ankle sprains, studies that were performed on animals, the ones that were conducted and uh, published before 2010, and then studies that were not written in the English language. So I found 3 studies that I used and included as best evidence. 2 of them were randomized control trials, and 1 was a systematic review. All 3 articles used or compared therapeutic exercise and RICE as the treatment of lateral ankle sprains. 2 of the 3 articles found that using therapeutic exercise right after a lateral ankle sprain injury, the patients regain ankle range of motion and muscular strength earlier than the RICE group. However, the systematic review noted that rest, ice compression, and elevation should be used for the first 4 to 5 days after an ankle injury. There is moderate evidence that favors using therapeutic exercise in the treatment of acute grade 1 and 2 lateral ankle sprains during week 1 and 2. There is no long-term difference between therapeutic exercise and rest, ice compression, and elevation groups. So after week 4, there was no swelling in either group. The pain rating scale was similar, and there was no pain with rest between those 2 groups. The recommendation of initial treatment should be directed towards avoiding or diminishing excess swelling and ongoing injury. If you have any questions, you can email me at this email below. I will try to get back to you as soon as possible.